Welcome to Medicine Handy Point. Today we are discussing urine test interpretation. This is part 2 of the video series which we are doing on urine test interpretation. So let's begin. The normal color of the urine is pale or yellow. So if the patient comes with the urine RE report, which is the urine test report, and it shows color of brown, it could be myoglobin, which is formed as a result of muscle breakdown. It could be because metronidazole and nitrofurantoin medication, these are antibiotics. On the other hand, if the urine test show green or blue color, it could be pseudomonas infection, or it could be tricyclic antidepressant medication, which are antidepressant medication. If the urine test show color of orange, it could be rifampicin used, which is antitubercular drug. If the urine color is red, it could be hematuria, hemoglobinuria, or beetroot consumption. If the urine test shows dark yellow urine, it is usually concentrated urine. It could be because of dehydration, it could be because of excessive carrot use, or it could be because of jaundice. Thank you for watching.